Welcome. My name is Kimberly. I am happy to share with you a very special guest. Her name is Ashley, who, like many of us, are currently living with T1D. In the spring of 2020, Ashley was suddenly diagnosed with COVID-19. She is here with us today and has so kindly offered to share her personal story with us as we all continue to navigate through the world pandemic of COVID-19. Welcome, Ashley.
Thank you.
Thank you for doing this today. I know so many people have a lot of questions, and also a lot of people in the world are very fearful of getting COVID. It's been, from where we are, going on pretty strongly for about 7 months. So
Yeah.
Thank you. When were you diagnosed with COVID-19?
It was August 23rd, I believe was the exact date.
Oh, August 23rd. Wow.
Yes.
So it hasn't been that long ago.
Oh, yeah.
Wow. Do you have any underlying health conditions besides type 1?
I have asthma.
You have asthma.
Yes, as well as migraines, but that's all.
That's all. Okay, wow. How did you know that you had COVID-19? What were, some of the signs and symptoms that you initially had at the onset?
So about a week prior to being tested, I started with shortness of breath, which I thought maybe was just related to my asthma.
Sure.
I treated it with my inhaler, my albuterol inhaler, and I noticed it a lot, like especially going up and down steps, more activity caused more shortness of breath. So I was like, oh, like maybe I need to lose weight or something, something magically happened there. And then it was about a week it went on, and then it eventually stopped. And then I was taking a shower one morning, and I have mint soap for my hair. So I always smell the mint. And I didn't smell it at all, and I was like, oh, like that's, odd. And then I was actually on vacation when all this happened.
Wow.
So I called my PCP right away and came home. I was in New Jersey at the time. And then by the time I had gotten home and I got tested that night, I lost my taste then.
Yes, there are some of the signs of COVID. So you probably at that point felt like you probably had a good chance of having COVID.
Yeah.
Yeah. Well, leading up to this, were you taking any precautionary measures like wearing a mask, washing your hands a lot?
Yep, I was doing all that. I actually know when I had got it. On scene of calls, we have to wear an N95. That's the baseline, as well as gloves. But with COVID going on, if you're dispatched to something where you feel it's going to be COVID related, you're supposed to wear the full gown and eyeglasses.
Yes.
So I had all that on for a call we had gotten dispatched to, was shortness of breath. And the lady really wasn't doing well. She's really struggling. My glasses kept falling down.
I see.
They were just getting in my way, and I had to focus on taking care of her. So I just took them off. It didn't really cross my mind at all. And when I had went to pick her up, basically just like picking up a child, she coughed right in my face. She didn't have her mask on. I failed to put one on her. Because at that time, you're worried about their life. You're not necessarily thinking about all the precautions that you should be.
Wow, you're amazing. You're a real hero. I should mention that you're an EMT.
Yes.
So she was, being dispatched for a call and found someone that obviously had COVID. Did you know that she had COVID at that moment? Did you suspect it?
She had a history of congestive heart failure as well as COPD. So we really thought it was an exaggeration from that. That's what we call it when they really are having trouble. But we had gone to the hospital, and within 3 hours they'd called our station to let us know that she did test positive. So then we have deconned everything right after the call, but then we went into special precautions afterwards to decon more.
Oh, I see. Wow, were you scared at that moment because you know that you had direct contact and she coughed in your face?
I was. I actually was on the phone with my mom when I found out, and I started crying, and then I was Well, like I won't be that 2% because it's like 2% chance you can get it in your eye, and
Sure.
as well as I was a little frustrated with the fact that the patient like coughed in my face. Like I don't know. You think that adults especially have that, okay, I cover my cough, but then like when I would go back and think about it, like she was really struggling, so that probably wasn't in her mind, just like putting a
Yeah.
mask on her wasn't in mine at the time.
Yeah, she was probably didn't know she was going to make it perhaps, or like you said, was really scared and she just wanted to, breathe normally. And
Yeah.
you jumped right in there and did your job. So that's amazing. You're a frontline worker. Amazing. Amazing. So we want to share with everybody what happened. So then you called your doctor, you got tested positive. What were some of the next steps that they suggested that you do? And how did the coronavirus, continue with you? How did it manifest?
So I had come home from vacation, like I said, got tested. Because I am a frontline worker, they did it as an expedited test. So it actually came back. I got it at 6 p.m. at night, and the test results were back by 2 a.m.
Great.
So my
Yeah.
doctor had it by 2 a.m., and she called me at 9 in the morning, and she just went over everything. She explained that I was positive. She asked me my symptoms, and once I had told her about, the shortness of breath the week prior, she really felt that I probably like hit the hardest part. I was over the hurdle. And if
Wow,
I
I'm
had,
sure glad to know that.
yeah, if I had, like tested my oxygen saturation, I probably would have been low at that time, and then, you know, would have had to go to the hospital. But since I just kept ignoring it, although you shouldn't.
No, I know you because you had asthma. It makes sense.
Exactly. And that's what it felt like. It felt like, an asthma attack type of thing.
Yeah. Was your blood
Sugar any different when you started having the shortness of breath? Did you notice a correlation with any change in your blood sugar?
So for something with me, every time I get like a viral infection, so something as far as like a cold, or in this aspect, COVID, my blood sugar drops. I can't keep it up. It kept dropping. So I knew something was going on, just, not exactly what.
So how we say dropping, how far were you dropping? Like 20 points, 10 points?
It was, well, so if like my standard, is like 100. So I was always below 70 when I would drop, especially at night, waking up. It would wake me up often. It was like the lowest I think was 34. I'm not even sure how I was like still
Wow,
comprehending.
that is scary. 34. That's very,
Yeah.
very low. Wow. Do you have anyone living with you? Do anyone to monitor you and help?
Well, I have the Dexcom on, as well as we were on vacation. So I was in a cabin, and I was with my sister who's 16, my cousin who is 14, and then my daughter was also there, but she's only 1, so she doesn't comprehend that. But I'm really good for some reason when I am low, like to catch it type of thing.
That's really low. What did you do? Treat it as you usually do? And did it respond typically like you take a juice or you take glucose tabs? Did it respond?
Yes. Yep.
So was it any different than any other flu, just in terms of how the blood sugar responded? Or it seemed like you treated it and it responded?
It was odd for me that it, like I said, drops instead of, if for some reason I have like bronchitis, like I've had before, my sugar's high then. So, I've also had a UTI, like my sugar's high. And high, I mean like 300s, which drives me crazy when it's that high.
So it sounds like they're bacterial infections, correct?
Yeah.
And
Yeah.
you go high with bacterial infections, but coronavirus is a virus. And when you have a virus, your blood sugar tends to go low. That's very fascinating. I've never heard that before. All right, so you're on vacation. What did your doctor tell you to do? I mean, she thought you were through the worst, and then what happened?
So I was at home at this point, and she had called. She told me that the CDC would be calling me to get in contact with anybody who I'd been with the past 14 days. And she basically told me like I had to stay home. But the quarantine part started when my symptoms started.
I
So
see.
basically, like, I had just, got diagnosed. I was positive, but I didn't have to stay at home for 14 days because
Okay.
I was already so far through it, which that for me was like, mind blowing type of thing. So I think mine was like 10 days I was at. So I had to stay in, and then they did a follow up as well. So they did a follow up call, which was 2 days after my positive test, to see how I was feeling. And then I did request that I have an additional test just to show that I was negative for when I returned back to work.
Right. Do you know if you have antibodies?
I was told I do. I haven't gotten tested for them yet, although I know, I could,
Right.
but I have not gotten tested yet for it.
Right. So how long, so it sounds like you had the coronavirus for how long? 2 weeks?
Yep. Yeah, it was approximately 2 weeks.
And once the 2 week mark was complete, did you still have like residual symptoms like maybe fatigue or, labored breathing?
Nope, I didn't have any of that. And my sugar, like, even after, it was probably within halfway through, like, my sugar started to be more steady and not drop as often as it was. I had also decreased, like, basal rates while I was, was in that time frame where I was dropping.
Yes, excellent. Excellent. Were you hungry? Did you have an appetite during this time?
I really didn't, but since I am, diabetic, I always make an effort to eat something,
Sure.
no matter what. So I
Right.
did attempt to eat as well.
Right.
I did on, like, paper wise, I did lose weight. I mean, they're not sure if that was from COVID or if that was just, happened
A
to
lack
be.
of appetite. Yeah.
Yeah. Yep.
Did you take any over-the-counter medications or any vitamins and herbs while you had COVID?
So when I started with the shortness of breath, I also had, which felt like it was just like a side effect from the shortness of breath, but like nasal congestion,
Yes.
nasal drainage. So I had taken Mucinex, but it's like a knockoff brand of Mucinex. It's called Mucus Relief. So I took that. I was taking that once a day. I was also doing cough drops, even though I didn't have a cough,
Right.
as well as little home remedies that I've heard of. I've heard that when you have, like, mostly towards COVID, I heard that if you drink hot fluids, it flushes the mucus out of your system instead of draining into your lungs. So I had drank hot fluids more than I normally would, as well as did salt and warm water. I did the gargling for that.
Great.
When I did start with the shortness of breath, as like, I kind of knew, but I didn't want to know type of thing.
Yeah.
So, like, I started treating it as if it was COVID. And, looking back, it's probably my wrong to go on vacation. But by the time I went on vacation, the shortness of breath had went away. So then I was like, oh, well, maybe it was just asthma type of thing.
Yeah. Did anyone on vacation that you were with end up contracting COVID-19?
So I was with a total of 15 people in close contact, sharing drinks, sharing food. And the only person who got it was my 1-year-old daughter.
Wow.
So, and
Oh my
everyone
goodness.
quarantined, everyone was tested, and everyone was negative, except for her.
Very, very lucky. So tell me about your daughter, 1 year old. That's so young and so vulnerable in the lungs, in their development. How is she doing? What was it like for you guys?
So, towards the end of our vacation, before I was even, came out positive, she had started with mouth breathing when she was sleeping, which I had noticed and thought was a little odd. She, always breathes out of her nose, but she was breathing out of her mouth, and pretty rapidly. It was more,
Yeah.
occasional than she typically breathes. And besides that, she also did, like, once we got home and everything, she did spike fevers. Tylenol did bring them down for her. I may have had a fever, but I really don't know. I hadn't tested. Like, I'd have, like, hot flashes occasionally, but I hadn't checked my temperature at the time.
Right.
Because I also was, like, drinking alcohol with my family. Like, so I'm thinking, oh, and I mean, I'm 21, but I don't drink that often. So I was like, oh, this alcohol is giving me a hot flash type of thing.
Yeah, I see.
But I'm wondering, like, looking back, like, was it really a fever? Like, you know, that just had changed really quick.
Yeah. Did you continue to have your headaches? And how about your taste and smell? When did they start to come back?
So about 3 days after I tested positive, they both returned. Not, like, fully back to normal, but just slightly, which I was relieved with because it was just crazy. I'd never experienced not having, you know, your senses for that, so that was crazy. And, you know, that stuff I won't know if Ava, you know, experienced or not because of, you know,
just being one. Yeah. How long did it take for Ava, your 1-year-old, to recover from corona?
So she was like a little longer than me. I think it was about a week after. We kept her quarantined for an additional week.
Yeah. That must have been really tough being sick yourself with something very substantial, right? And then being in quarantine and then having to take care of a 1-year-old, which is, you know, can be challenging on its own. Hello, Ava. You look like your mama. Amazing. Oh my goodness. It sounds like you're a really, really strong, really smart girl, and you really knew what to do. And at any point, did you have to reach out for help?
No. So Ava was born premature. She was born at 34 weeks. So it was a little frightening. But what I did was I figured since my symptoms, you know, were relating to the Mucinex that I had, I bought her children's mucus and cold or something like that.
Okay.
And I had given her that with, you know, the okay from the doctor because it is for 2-year-olds and up. So since she was under 2, you know, I made sure I got the correct dose from them.
Okay.
Which definitely helped her.
Wow.
But nothing else besides that.
So I want to talk just a little bit more about the diabetes. Information out there says that type 1 diabetics are necessarily more at risk if their blood sugars are in range and they have, you know, really good A1Cs being, you know, not too far above 7. Can you share a little bit about your history with type 1? Did you have good, it sounds like your numbers were in range, you said around 100, and your A1C, how your A1Cs leading up to it, do you feel like you were in good health?
So as far as my A1C goes, I am still working with my endocrinologist from when I had Ava to get my sugars back down. Unfortunately, as good as the Reading Hospital is, they don't have the best endocrinologists, or that's not their strong point. So when I had Ava, of course, everything had to be changed, and they did that at the hospital. So it wasn't my endocrinologist who's used to me. So after I had Ava and went back, so it was probably like 6 months after she was born, my A1C was 10.3, which was very high. As the highest I've been is 13, and that was when I was diagnosed. So we had been working it down, and I was at 8.9 when I did have COVID. So my numbers were around like 200, but I'm in the process of coming down. So that definitely, you know, helped. But it's, you know, I was higher up there than you should be. So I don't know if that.
You're not sure. And yet you did have literally direct contact and exposure. So you could have been the healthiest person and gotten it anyway.
Yeah.
Knowing what you know now and what you've been through, what advice can you give to the people watching, the others that have type 1, that just about prevention, and also if they're sick, if there was maybe something that you felt you did that made a big difference?
I say, just stay home, and especially if you're, not feeling right. If I had to go back, I definitely would have not went on vacation and just stayed home.
Yes.
Then I wouldn't have exposed all the people I did. And, I know for a fact that there was 15, but that was my direct family. So, there was the campground that we stayed in. There was all those people I come in contact with, and I don't necessarily know them, so I don't know how they ended up. But I also took precautions, so I wore my mask while I had it. And as far as people who don't have it, don't want to get it, I suggest, you wash your hands, continue to use hand sanitizer, and wear your masks as far as that goes. But also cover your cough, cover your sneeze, you don't want to fly around.
When did you start to go back to work?
I think it was like 2 weeks since my symptoms had started, since that was the rule I had to follow by my PCP.
Yes.
And I was negative because I was tested the day before I went back to work and got my negative result to make sure that I wouldn't, give it to anybody. As well as when I went back to work, following my medical director, I wore my face mask, into work. We're supposed to wear them, especially in close contact with anyone. But I made sure I wore mine no matter what, just in case there was that.
Do you have an N95? How about a face shield now?
No, I don't have a face shield because they're actually frowned upon because it can get up and underneath the face shield.
Are you doing anything different now to protect yourself from getting the coronavirus again? Because the data says we don't really know if we can get it a second time. Are you doing anything different? For instance, are you getting more sleep? Are you taking any vitamins? Or I'm assuming you're wearing your mask, but anything.
I'm not doing anything different. I'm remaining the same. I'm still wearing my mask, washing my hands, using hand sanitizer, as well as I started taking vitamin C gummies when I started with my shortness of breath, and I've continued with those, not knowing if that's helping or not.
Yeah, great. How about the flu shot? Are you planning to get a flu shot this year?
Yes, I do plan on getting that. It was suggested to me that I get mine as well as Ava's when it's more closer to October. Because then it's more, it's closer to the time that's
the flu season.
That everything's going on. That's what the PCP as well as her pediatrician recommended.
Right.
Especially since she's high risk because being premature and I'm high risk with the diabetes.
Great. So now that you're recovered, I just want to make sure that you're still feeling well. You're not tired. You don't have any more asthma-like symptoms. No residual feelings from the COVID. No headaches.
Nope, nothing that I experienced.
Amazing. Has the doctor given you any special instructions?
There's nothing she suggested to me. And, she said it affects everyone so differently.
It really does. So can I assume that your experience with COVID was pretty similar to another type of flu in terms of duration, and maybe some of the symptoms were different, but your blood sugar and in terms of your diabetes?
It definitely acted as if it was like a flu.
Do you have any advice, anything you want to share for the people that are watching this segment?
I, as well as so many people who are annoyed with the masks, but even though I'm annoyed, I still put it on, because it decreases your risk. It's not going to protect you 100%. It's been proven it's not going to, but it decreases your chance of getting it. So continue to, obey that law, rule, whatever they consider it now. And continue to wash your hands, cover your sneezes and your coughs.
Yep.
And if you start with symptoms, I honestly would get a vitamin C tablet. And I actually ordered it from, what I did was we had to go to the grocery store, but of course my whole house was in quarantine. So I ordered a Walmart delivery.
Yes.
And I had the guy, I said, just put it on, like I typed in the thing, like just put it on the porch. And then once he had left, then we brought it in. But that's how I got the vitamins and the Mucinex stuff. So I suggest treating it like that. And that's what the PCP said too. You know, there's no certain medication
Yes.
that prescribe you or you can get over the counter. But you just treat it as if it's a cold or the flu.
Exactly. That's amazing. That's really helpful to know that you know, had asthma and you got the coronavirus, and we all know the fear about the lungs. And here you did have asthma, and here you were. You followed your instincts. You did things that you knew would help. You still went on vacation. Sounded like you managed it really well. And that, look at you. You recovered within 2 weeks. Now you're back to work. Here you are. You have a young baby, 1 year old, also had it, incredible, and you're sitting here with this like big smile and so calm. You're like really an inspiration for people. Thank you so much.
Thank you.
Yeah, it just sounds like follow common sense. Having type 1 doesn't make it any more dire. We just all have to be safe.
Yeah, treat all treat it all the same type of thing.
Yeah. Just curious, if a vaccine comes out for the coronavirus, are you for it or against it?
I think I, definitely would get it because I had it, I've had a doctor from my family care practice tell me like, oh, you're good for a year, you have immunity, and then I was like, okay. And then I've also had somebody, I actually tried to give my blood because they say that if you had COVID, you have the antibodies in your blood, and then you can donate it. And what they do is they use it for the people that are very sick.
Incredible. Good girl.
But they wouldn't let me because I'm diabetic.
Oh, wow. Why? Too risky for you or too risky for the patients out there?
No, so asking, talking to the nurse, she said it's too risky for me, like, because, it's the blood and chances are, like, I would drop really low donating it.
Yeah. Yeah, it makes sense. Why put that strain on your body?
Yeah.
Right.
So,
Great.
So I decided not to. I was really, like, excited to be able to help out, but,
You're an angel, I tell you. You rescue someone, you help someone save their life, and now you're trying to donate your blood. You're amazing. You're inspiration. Ashley, thank you so much for sharing your story. Wonderful story, a very interesting story, and you shared a lot of insights. And I know a lot of people out there will feel secure knowing that you went through all of that, and look at you now. So again, thank you so much. You made my day. I had a hard time finding someone that wanted to share their story, and I know how important it is. People ask me all the time. You're the only brave soul who did it, so I really thank you.